Hi again, this is Sam Shepard, and I want to thank you so much for sending in even more questions. Some of them are seem to be at graduate level type questions. Um, Feel free to send in your questions to AskSam@Velasta.net, and we'll get to them hopefully in the next session. It looks like it's going to take a little longer than 30 minutes to do some of these. They seem to be coming in certain categories. There's two parts to today's discussion. The first part is going to be answering the questions. The second part is I'm receiving a lot of inquiries into how does the immune system actually kill the cancer and take out the inflammatory necrotic tissue. And I'm going to deal with both of those as best I can. Typically, this is a 10-week course in graduate level studies. I'm going to try to do it in 30 minutes. So I'm not going to get into a lot of details, obviously. And some of it I'm going to be amiss in trying to try to explain it in the detail that some of these questions require. I'm lumping the first into a series of questions regarding inflammation. Here's one from Debbie. It says, my question is, will Velasta help me rid inflammation? I have a CRP of 37. And I'm not going to go through exactly the entire content of it. There's another one here from Beth. It says, I have several questions about help with family members, thyroid cancer, Hashimoto's disease, prostatitis, diverticulitis, bladder fistula, interstitial cystitis, fibromyalgia, and diabetes. I'm going to lump all these into the same. These are all inflammatory related diseases. These diseases would typically run your C-reactive protein well over 3. So that's the first thing I want everybody to focus on your next blood work, is to see what your C-reactive protein levels are. And in this case here, typically all of these would have very high C-reactive protein levels. The Velasta is going to drop that number and eliminate that inflammatory response from the liver that's causing systemic inflammatory disease. Let me deal with the cancer first. I'm going to touch on it even more so. There's two methods of kill we've been able to identify. One is a inhibitory effect on the tyrosine of the PD-L1 of the tumor cell, and I've explained that in some other videos. The most prevalent kill we're finding is that the glucosidic astaxanthin that Velasta makes is highly absorbed by the cancer cell due to its glucose presentation. So once it's inside the cancer cell, pulled into the cancer cell, it donates an electron to the hydroxyl zero charge, hydroxyl free radical, and it converts that free radical into a hydroxyl ion, having a -1 charge. The pH will shoot up above 10, and it kills the cancer cell. It actually hydrolyzes the phospholipid membrane on the cell, causes the cell membrane to rupture the cancer cell, and all of the guts of the cancer cell then are discharged in the interstitial areas between the cells, and the blood system then picks those up. The lymphocytes, macrophages will attack it, and that increases your inflammatory size. If you looked at it from a CAT scan or an MRI, you would see the actual size of the cancer appear to enlarge. That's not necessarily cancer cells enlarging. Oncologists are always going to believe that it's increasing cancer, and they're going to highly recommend that your cancer is out of control, you need to be on chemo, when in reality they can't differentiate between cancer and the inflammatory response from the necrosis of the cancer cells. So when it comes to thyroid cancer, Hashimoto's, prostatitis, diverticulitis, Crohn's disease, diabetes, taking Volasta is going to have a very quick response to these types of diseases. And you'll see most of the inflammation resulting from these, the symptoms resulting from these diseases will go away very quickly. On especially type 2 diabetes, you want to watch it very carefully because your blood sugars will drop if you're still taking metformin or insulin. And you want to monitor that every single day. 30 minutes before you eat lunch, you take a sugar reading. And that number should get lower and lower until finally, after about 30 to 45 days, you'll probably be off of all treatment of your diabetes. Let's see, here's one from Anne on myasthenia gravis. She's on a plant-based diet. This is also an autoimmune disorder. It's all inflammatory. There's no downside to taking Volasta. There's no risk. And the potential, the upside potential is going to be tremendous. So it's definitely worth a shot. And you'll know very quickly. I would give it at least 30 to 60 days. And you should start noticing a difference in your symptoms. Make sure you fully understand what your symptoms are so that you can monitor your progress. Here's Jim and Linda. My wife had Parkinson's. Deep brain stimulators installed in August 2006. She's 73 years old. I want to spend some time here with Parkinson's disease. When we gave Volasta to people who had cancer and secondarily, which we found out later, also had Parkinson's, their Parkinson's tremors stopped. So it sent me back into the research lab to figure out what in reality was going on here. And one of the things that we found was that when dopamine, which is what they think is a lack of dopamine production in the brain, is what causes Parkinson's. So when they believe that there's a lack of dopamine production, they prescribe levodopa or carbidopa to elevate the dopamine level. This is only treating a symptom. In reality, it's not that the brain's not producing enough dopamine in most cases. The Parkinson's patients have a much higher level of hydroxydopamine in their brain. Now, oxydopamine is a molecule we give to animals to give them Parkinson's so that we can test Parkinson's medications on. Seeing that high level of oxydopamine to dopamine ratio in the brain in Parkinson's and in Alzheimer's, by the way, but primarily in Parkinson's, the way oxydopamine is produced, it comes from a reaction of dopamine with a hydroxyl free radical. That reaction in the brain causes oxydopamine concentrations to increase. That takes away dopamine and the functionality of dopamine, resulting in tremors and Parkinson's type symptoms. This has a tremendous effect because Volasta neutralizes the hydroxyl free radical. So if the hydroxyl free radical goes away, then there's no more oxydopamine produced and the symptoms of Parkinson's disappear. That's the that's a little different than the general thought process right now, but it appears to be substantiated in a lot of the work that's being done. Mohammed writes, I would love to hear from you on how Volasta works on ER/PR HER2 positive metastatic breast cancer. As all cancers are different, how does Volasta fight HER2 metastatic breast cancer in comparison to hormone? Estrogen receptor type cancers, it's not the estrogen that causes the cancer. It's the ability of the estrogen to produce the hydroxyl or reactive oxygen species. And when we're young, for example, young women don't necessarily get cancers unless their cellular antioxidant levels have been greatly diminished for whatever reason. Typically, glutathione is one. SOD, which is superoxide dismutase, is another. Once those cellular antioxidants go away, and in women on average, it's after age 42, it makes it highly susceptible to the hydroxyl concentration caused by the estrogen reaction on the estrogen receptors. I know that sounds complicated, but without that cellular antioxidant, the more estrogen you have, the more hydroxyl free radicals you produce, the higher your probability of getting these cancers. So Valasta is 22 times more potent than glutathione. So if we can eliminate, again, those hydroxyl free radicals generated from excess estrogen or the estrogen receptors, then we're just getting you back to your antioxidant level pre-42 years of age or back into your 20s. It's not that Valasta does anything with your hormone level. Your hormone level is going to fluctuate as you change. Valasta doesn't interfere with that. But what it does do, because of your glutathione loss, your cellular antioxidant loss, it's going to replace that and give you more protection, even though your hormone levels are fluctuating. Another part of Mohammed's question here, which is pretty interesting. He states, in your latest Q&A, you talked about CT PET scans showing increase in tumor growth versus inflammation due to killed cancer cells or necrotic cells, as these scans can't differentiate between the real cancer tumor versus the inflammation response due to the dead necrotic residuals. I would like to ask, what is the best way to measure this other than CT, PET, MRI, ultrasound scans? Can C-reactive protein and CEA marker tests provide more accurate information? Oncologists are trained that whenever they see an increase in mass density from a CAT scan, they automatically assume that it's related directly to cancer growth. And they've incorrectly prescribed chemo and radiation to cases where that isn't necessarily the case. It could have just been an inflammatory response, and unfortunately the chemo then acts more as a poison and starts to take out the bone marrow, the white blood cells, the platelets, the red blood cells, and damages your immune system. So it's absolutely imperative that before anyone does something as drastic as chemo or radiation, that their doctor confirms without a doubt that you have viable cancer cells to be treated. Don't do it out of fear that you may have cancer cells, because that'll get you hurt. And they can do no harm. So make sure that you're actually treating for the problem and not a guess, or because somebody believes something may be happening. Let's see here. Here's one from CJ. Your videos have proven to be a great source of knowledge. Does Valasta need any additional supplements to speed up the process of flushing out the dead cells and bodies? This is one I'm going to lump together. There's three ways. There's three ways that cells die. It's apoptosis, it's necrosis, it's there's another one called ferroptosis, and I'm going to deal with all three of those mechanisms. Apoptosis is cell suicide. The cell chooses to die. And there's a lot of things that do that. There's no inflammation associated with it. The cell dies to make room for other cells. The cell dies because of a viral infection, which can be inflammatory. That can be necrotic also. Necrosis is caused by trauma, chemical death, a bullet wound, a scab, a wound, an insect bite. Cells will die because the inflammation takes those useless cells out. And those cells are what's called, they go into a necrotic state. They send out inflammatory signals through the ROS, or reactive oxygen species, typically. And then the immune system moves in and cleans up the dead bodies on the battlefield. It has to clean up the debris, not just the cells. The cells very seldom are taken out in whole. So the cells rupture, the cell membrane ruptures, all of the cytosol and the guts of the cell are expelled, and that debris field has to be absorbed by the immune system. So in reality, there's basically two ways that you can get rid of dead cells. You either do it through your immune system or you do it through surgery. And those are the only mechanisms of doing that. Your immune kinetics, the rate at which your immune system can take out that debris, is dependent on your general health. Are you healthy? Is your immune system intact? That's why it's so difficult with people on chemo that get a suppressed immune system. They can't fight off diseases. They can't get rid of all that debris. So it actually increases their inflammatory disease state, which eventually will result probably in cancer. And there's an 87% chance that they'll represent with cancer. Here's another one. Let's see. John talks about prostate cancer, and he said, I know you touched on prostate cancer. You mentioned to watch the results and adjust. My question is, can this make prostate cancer grow? And that is why we have to watch it. And secondly, how does Valasta react with Lupron or other hormone suppressing drugs? Valasta only stops the inflammatory response, so it's one step back from treating symptoms. Lupron is a symptom treating drug. Valasta is one step back beyond that. So there is a point at which you probably would not need any of those hormone suppressing drugs if we can get your PSA in line. Now, Valasta does not make prostate cancer grow. So that's not it. What I meant by watching it is make sure that you have your PSA run so that you know, because Valasta is dose dependent. So if you see an uptick in your PSA, then you can increase the dose. If you see your PSA drop below 3, for example, you don't need as much Valasta. That means your inflammatory disease state is not going to pose a problem and put you into a disease state. So that's what I meant by watching it. Also keep in mind that make sure that your PSA is taken at least 3 days after sexual activity. All sexual activity in males raise their PSAs. So you can get a false positive simply because of sexual activity. Billy writes, I recently spent a good chunk of money on a mild hyperbaric oxygen chamber. Does this have a positive effect on Valasta absorption, no effect, or a negative effect? Oxygen barometric treatment is one that was used primarily for trauma, for wound healing. It also has a antibiocidal effect, but it's typically used to increase the rate of wound healing. There's some NIH reports showing that hyperbaric oxygen treatments will typically increase the ROS concentration because you're pumping more oxygen into your body, but it has a downregulation effect on neutrophils, basophils, and some of the normal killer cells that make it to the wound in the first place. Those cells, although they keep bacteria away, can have a negative effect on the wound healing. So if you can negate the number of neutrophils, the inflammatory response, then that allows for more cells to grow, because there's 2 rate limiting steps. The first one is the rate of generation of new cells to heal a wound. The negative side is the rate at which that inflammatory response for stem cells causes other cells to die. So you have the rate of generation minus the rate of death equals the accumulation of new cells. So if I can decrease the rate of death, then I increase the rate of new cell growth. So from a mass perspective, that's how it works. Let's see what else I have here. I have one from Yuri. I've been taking 12 to 13 pumps of Velasta daily for almost 5 months for stage 4 prostate cancer. My question is about the possibility of dealing with sciatica or bone pain using Velasta. We do have a DMSO product, but before we get to that point, I would really like to see what your alkaline phosphatase number is. That number should be less than 120. If it's greater than 120 and you've been diagnosed with stage 4 prostate cancer, it's an indication that the cancer is in the bones. And at that point, we would want to run a fairly high Velasta concentration until we can see that alkaline phosphatase number come down under 120. Once it's under 120, that means there's no more bone dissolving, which implies that the cancer is probably dead in your bones. If it's dead in your bones, it's going to also start dying off in your prostate. So there is a definite dose response curve. So so far from what we've seen, as we increase dose, the response gets even greater. So there's two things that happen in this case, and I don't know how mathematically inclined you are, but there's a term called Gibbs free energy. And Gibbs free energy, like I said, this was a graduate level course, but Gibbs free energy is the energy it takes to drive molecules into cells to do chemical reactions with. But Gibbs free energy is equal to a rate constant times temperature times the logarithm of the high concentration divided by the low concentration. So we look at Gibbs free energy, which is the driving force when we look at dose curves. And when we increase the concentration, the logarithm of the concentration over the initial concentration, or the concentration outside to inside, that number goes up in a logarithmic fashion. So you can increase that dose and get a very positive response because the energy going into the system is now available for the either absorption or chemical reaction or whatever it is that you're trying to drive with concentration. Velasta follows the same pattern. The more you use, the more intense the response. But the more you use, you'll notice that your stool will get redder. A little bit more is going to be wasted. So it comes down to an economic decision at that point. But those who are terminally ill and are having no other recourse of action, increasing the dose can have an extremely positive effect on your disease. Yuri's second question, how long does Velasta stay active after consumption? It has a half-life of a little over 36 hours, which means that if you stopped in 36 hours, half of that which was lipid soluble in your body, it gets metabolized. In another 36 hours, half of that disappears. So in 72 hours, 72 to 80 hours, you only have 25% of what you had prior to that period. Have you ever considered studying dragon's blood sap for dealing with inflammation and cancer? I have. Dragon blood sap is a very high ORAC score. I believe it's even higher than astaxanthin. It's not something that's readily available, and there's not a whole lot of work done at the NIH level on that. So I don't know enough yet to recommend anything, and I don't know the quality of it. or how the dose would be administered. So, but dragon's blood right now is probably the sap is one of the highest known antioxidants. Joya says, I know that legally you cannot make any claims or guarantees. That's true. I just want to know what product I should order and amount to take for recurring uterine high-grade serous carcinoma. It depends on body weight. Initial dose is going to be 1 milligram per kilogram of body weight. So basically, you take your body weight, divide it by 2, which is the easiest thing to do. And that's how many milligrams per day that you would take. Now, there's 13.5 milligrams in a single pump of the oil. There's 24 milligrams in a chocolate segment. And all that's with the information that you would get. Daniel writes, does oral Valasta cause yellowing of the skin over time by taking large doses of Valasta as recommended? I weigh 150 pounds. A half of my weight would be 75 milligrams daily. Divide by 13.5 gives me 6 pumps. Not even close. We've been as high as 3,000 milligrams per day with no discoloration of the tissue. I doubt you're going to cause the yellowing. It's usually a pinkness, a pink color. Yellowing is typically a sign of jaundice. You want to look at the whites of your eyes and make sure that they're not yellowing. That could be a whole different diagnosis. Daniel also writes, what is considered a prophylactic dose at 150 pounds on a daily basis? Do you continuously take 6 pumps? No, you don't do it by dose. You do it by your C-reactive protein. If your C-reactive protein is less than 3, you cut your dose in half. If it stays below 3, you can cut that dose in half. If it goes above 3, you increase your dose. So it is directly related to C-reactive protein, and everybody should be running their C-reactive protein. That is an indicator of your predisposition to get an inflammatory disease. My question is, in the interview, you were discussing that bleach neutralizes Valasta to take away the red on stains. Does this also apply to taking MMS, chlorine dioxide? I do not recommend chlorine dioxide because once it hits the stomach, you can generate chlorine gas. You can also generate bleach. MMS is used as a disinfectant. It will also disinfect your normal cells. It is a free radical, very reactive, and I'm not a proponent of anything that causes bleach formation. Now, MMS, which is chlorine dioxide, and if you mix it with water, will form a chlorate or a chlorus, and it will take the color out of Valasta. It will neutralize it. Those double bonds, the same as in your phospholipid membrane in your cholesterol, and I'm going to talk a little later on that, it will react, and it will form water-soluble functional groups onto your cholesterol, onto your diene bonds, and it can cause total cellular membrane failure. That's how chlorine typically kills bacteria, and MMS has the same characteristics, but it will neutralize the Valasta. Deborah writes, I saw your videos and was quite impressed, yet discouraged a bit. I was diagnosed in 2020 with an acute lymphoblastic leukemia, Philadelphia positive chromosome. I actually did all the many chemos and clinical trial, predisposition through genes does not necessarily imply that you are 100% bound to get a disease from that. There's a huge number of pathways in between. And obviously, one of the major pathways that we interrupt is the hydroxyl, the actual communication from the gene to the disease. We interrupt that communication by neutralizing the reactive oxygen species or the chemokine that causes that transmission of information. So there's you mentioned Velasta won't help arthritis pain if bone on bone. My whole lower spine is bone on bone. Will it help my body from all the destruction the prednisone did? Prednisone, although it can stop inflammation locally and acutely, is a chronic inflammatory. It will cause problems in the liver. It can cause water retention and hydroxyl formation in the phospholipid membrane. It'll cause water retention and changes in the cellular size due to the hygroscopic nature of the cell wanting more water inside the cell. So prednisone is always going to have this problem of causing water weight gain, and the end result is that you're probably going to be in more of an inflammatory disease state, and that's why it's very very serious if you're going to take prednisone for long periods of time, or any steroid for long periods of time, because they are pro-oxidants. They will, when in the liver, when they're processed, create an inflammatory response and cause some localized liver dysfunction, some kidney issues around the glomerulus in the kidneys. So be very, very careful with prednisone. She has several other questions here. There's water. Does product come? Oh, okay, I bet. I've been on Better Way Health's beta glucan for a year. I believe it helped my IgG come up quite a bit because it was in the 300s and now it's in the 600s. So I'm still immune compromised, but doing so well. I thank only God because I was given days to weeks to live in 2020. I needed 6 blood platelets. Okay. If I tried your supplement, can I stop the beta glucan or anything else I can eliminate, like vitamin C? You get enough vitamin C in your vegetables. I don't hear many people having scurvy nowadays. So we're all getting plenty of vitamin C. Beta glucan is another issue that is, I'm not sure I would stop taking beta glucan. It is something that's quite helpful. But with Velasta, from an antioxidant point of view, you don't need to take vitamin C. Let's see. Okay, so that is that one. Then I have, let's see if that's all of those so far. I think that's all of the questions that we have. There's several pages, but I hopefully have combined them so that the other people, they were very similar with regard to understanding inflammation. Most diseases, about 92% of the diseases that we get are inflammatory. This product seems to help with all of those. With that, I want to go through a little bit of a presentation here on how does cancer